Most important is not just him. I have a feeling in general medicine, I think we need to ask patients about their past history and family history. That is a no-brainer if you go back and talk about clinical training when we do clinical training in medical schools. But unfortunately, the technology has, I think, overwhelmed us so much that we are focusing more on laboratory evaluation of our patients and then doing a bunch of radiological evaluations, scans, CT scan, MRI scans. But what is very important in the realm of all this is a lot of times just talking to your patient, you will get your answer and you can make a diagnosis by just understanding better what is going on there. So for every disease, and particularly for any patient with a diagnosis of lymphoma, leukemia, any malignancy that comes to a hematology oncology clinic, particularly in adult hematology oncology clinic, because patients are already old enough to have a family history, old enough to have a history of siblings, old enough to have a history of extended families. And it is important to ask. And of course, it also applies to pediatric hematology oncology clinics. But I think pediatricians are more used to asking sibling history and family history more than adult hematology. So I emphasize, because there is your clue to a genetic diagnosis comes from family history. If there is family history of breast cancer, there is a likelihood of BRCA mutation. Same way, if you have a family history of lymphoma, there is a long list of genes I can give you where you should be ruling them out. And in this day and age, you don't have to go looking for one gene at a time. Most countries, in Western countries at least, we can do either panel-based next-generation sequencing or even exome sequencing, so that we are looking at the entire genetic footprint of a given individual and trying to figure out if the diagnosis of lymphoma can be attributed to a specific genetic defect. This is important in many fronts, because it is important for the family members to know there is a genetic component to the diagnosis of malignancy in that individual. It is important for that individual to know that their brothers, sisters, or children that they're going to have in future are at risk of developing malignancies. So this is, I think, is going to be the next challenge for healthcare providers to do the due diligence history taking with patients and get family history and personal history. If the patient has had one lymphoma in the past and this is the second lymphoma, you have to sit and think why. That is not normal, isn't it?